Hi YouTube, it's Judy. Today is Tuesday, July 14th, and I just wanted to send out an update on what occurred this morning. I had my pulmonology test done this morning along with my consultation with the exercise specialist. I had that this afternoon. It is probably about a little after 3:30, so I've only been home for maybe 20 minutes or so. But I wanted to tell you about the pulmonology test, and that was quite interesting. Went in there, technician took me into the room. There's a booth. It's a clear booth, almost like the size of a telephone booth, if some of you people who remember what telephone booths are. It's clear plexiglass, little cube. All that's in there is a chair and an extendable arm that has the mouthpiece. And if you're claustrophobic, you're going to find that to be very troublesome. I am not claustrophobic, so it really didn't bother me. What kind of bothered me was I won't say it was almost too big for the booth, but it was a tight fit. That's how small this booth is. The technician will explain the procedure. What's going to happen is you have a nose clip, and when he tells you to, you're going to put the clip on your nose, and you're going to then put the mouthpiece in your mouth and form a little suction around it. And then he will tell you basically what's going to happen. And you do the test like 3 times, as long as it's going well. More times if you can't do it very well. But about 3 times they'll do it. And what it is he'll tell you to, and you can hear him through the plexiglass. There's like a little microphone system, speaker system in there. And what he'll do is he'll tell you, okay, put your nose clip on, and then put your mouth on the mouthpiece, and then just breathe normally until I tell you. So you sit there for maybe 2 or 3 minutes just breathing normally. And then let's say, now I'm going to there's like a little plug in there that cuts off the oxygen. So he says, I'm going to put the stopper, and then after 2 puffs you'll be able to breathe again. So the stopper comes, and then you can start breathing again. And he'll tell you breathe normal, and then he'll say on your next breath, take a deep breath in and let it out easy. So you'll do that. Then he'll say, on your next breath, take a deep breath in and push it out as hard as you can, and keep pushing until you have no more air left. And you do that. And then he'll say, okay, just breathe normally. And then you breathe normally for another 2 or 3 minutes, and then you do the process all over again. So I did that 3 times. And then you step out of the booth, and he'll ask you, my technician asked me if I felt lightheaded, or was I having any chest pain, how was I feeling, and you just tell him if you were fine or whatever. And then you sit into another chair, and he takes the mouthpiece from inside that little booth, puts it on this machine, and then he'll say, okay, what I'm going to do is I'm going to tell you to take a deep breath, as deep as you can get it, and push out as hard as you can into this machine. And so you do that. And once that's done, the computer does its little thing, and then I had to go back and sit in the waiting area to speak with the doctor, who was going to look at the results and then let me know how they were. So I was called into the doctor's office, and I did pretty well. He asked me, what did I think of what was sleep apnea, and I told him, that's while you're sleeping, your airway gets blocked, and you're no longer getting oxygen, and then your body wakes you up, and then you start breathing again. He said, pretty much what it is. And especially people who are overweight, the inside lining gets very loose and droopy, so when you start falling into a deep sleep, everything relaxes, and then that's what closes your airway. Now, I'm not sure if I have sleep apnea or not. I don't recall waking up gasping for air. I do cough sometimes at night. I don't know if that's a symptom or a signal. I do snore a little bit. So he kind of explained to me he wants me to do the sleep evaluation, which in my head I'm thinking, put the brakes on, because now I hit a bump in the road. I was almost finished with every test that they asked me to take and procedure, and now it's, we want you to do a sleep test. Now for the pulmonary test, it took me 3 weeks just to get the appointment. So I'm thinking it's going to be 2 months before I ever get an appointment with the sleep evaluation people. So he said he put the order in. They'll be calling me later this afternoon so I could make an appointment. And he kind of wrote a letter to my surgeon stating what he thought, and that he recommends the sleep evaluation. And I did well on the pulmonary test. The only part I didn't do, I was below average in, I forget the terminology he used, but it was some kind of oxygen exertion kind of lingo. And I asked him what that was, and he says normally people have a certain reserve of oxygen left in their lungs, and mine was just a little below average. So I think that's why he wants to do the sleep evaluation. So I'm thinking in my head, oh geez, now I gotta wait another 2 months before I even get that done. So I was a little bummed, but he explained to me that during surgery, and I'll try to get, I'll probably have to do 2 videos because I notice my time is getting there. But during surgery, when they have the breathing tube in your throat and you're under anesthesia, when they take the breathing tube out, there's still anesthesia in your body. And he says, if we don't know you have sleep apnea, and then while you're in recovery or whatever, and your muscles start to relax and cut off the airway, he says once your airway closes and you're under anesthesia, it's very difficult for the technicians to get the breathing tube back into your throat. And another more important thing is that when you're under anesthesia and you close off your airway, your brain will not wake you up because you're under anesthesia. It's sleeping. So your body will not be able to wake you up. So I'm like, yeah, we better do this. So I left his office. You know, he said someone will call you this afternoon to make the appointment, and after that's done, then we'll proceed from there. Because if I do have sleep apnea, then we'll have to do treatments for at least 4 to 6 weeks. And he said to me, you will have to show proof that you're using it. Now I'm not sure what kind of proof that is, if I have to keep a diary, or I'll cross that bridge when I get to it. And if it turns out I don't have sleep apnea, then we can proceed as usual. So I'm going to cut it off for now, and I'll make another video about my exercise specialist. So talk to you soon. Bye.